So we are live now. I'm starting the recording. A very good evening to one and all present. Myself, Dr. Sapna Suri, Associate Professor and MBA Course Coordinator, would like to welcome you all in today's webinar on healthcare sector, transformation, opportunities and challenges in association with Indian Merchant Chambers, MSME Chamber of Commerce and Industry of India, New Delhi, World Trade Center, Navi Mumbai, Maharashtra Chamber of Commerce and Industry and Agriculture, MCCIA, Global Exports India, Global TV. I wish to throw some light on our university. DY Patil deemed to be university is UGC recognized. We are AICTE approved. We have been named NAC accredited A, and we have been ranked as 88 by NRIF. Now, I would like to take an opportunity to introduce to you our own DY Patil deemed to be University School of Management. We have been located at Sector 4 CBD Belapur, Navi Mumbai. We have state-of-art infrastructure. We provide 100% placement assistance. We have a 3-year BBA course, the admission for which is open. We have a 2-year MBA course, the admission for which is open. Whoever wishes to take admission can get in touch with us. We also have a new thing in our kitty, that is we have our own YouTube channel, that is DYPUSM webinars. So I would request all the participants who wish to view our own webinars which have been conducted so far, previous year also and till date, and the upcoming also, can like, share and subscribe our channel. I would now like to introduce to you Dr. Alpha. Dr. Alpha Lokhande is a business management teaching professional, currently working as an assistant professor with DYPUSM. She's an MBA in HR and PhD in management. She has also pursued diploma in training and development from Indian Society for Training and Development, Mumbai chapter. She has more than 11 years of experience in HR, general management and soft skills development. She has trained employees from organizations like ONGC, Pillsbury in cross-cultural communication, interview skills and stress management. She has published more than 20 research papers in various national and international journals with highest impact factor. I welcome you, Dr. Alpha. I would request Dr. Alpha to kindly address the participants and go ahead with the corporate presentation.
Thank you, Sapna ma'am. I'll share in my screen. Sapna ma'am, is my screen visible? Is my screen visible, ma'am? Okay, thank you. Okay. Good evening, everyone. I welcome you to the corporate presentation, a glimpse of DY Patil School of Management. We'll firstly start with the DY Patil Group, which is a sponsoring trust. Dr. DY Patil is the former governor of Tripura, Bihar, and Kolkata, the founder chancellor of DY Patil University. Dr. DY Patil is the president of the DY Patil University and president of the DY Patil Sports Academy. He's also the president of MCA. Dr. Ajinkya DY Patil, who is the president of Ajinkya DY Patil University, president of DY Patil Group, and the pro-chancellor of the DY Patil University. The DY Patil deemed to be University, Navi Mumbai, is established under Section 3 of the UGC Act. We've been NAC re-accredited A among the top 10 Indian universities. Let me introduce to you our Honorable Vice Chancellor, Dr. Shirish Patil, sir. He was the ex-dean of the DY Patil Hospital. The DY Patil deemed to be University School of Management, Navi Mumbai. This is located at Sector 4, Belapur. We have various accreditations to our kitty. So starting off with the first one, that is the All India Council for Technical Education. We've been also recognized by the University Grant Commission, that is UGC. our various recognitions. Times Business School has ranked DYP USM as the first or the #1 private university in Mumbai. The Week has ranked us as 13th in multidisciplinary universities in West Zone. Career 360 has ranked us as AAA plus in the best Indian university. Business World has ranked us 97th in top business schools. Business Today has ranked us 80th in best business school for future orientation. Business World has ranked us 74th in top B school category. Not only this, but DYP USM has also been awarded the second prize by the Higher Education Forum, especially in the terms of innovation. Our students have received award in innovation for inventing wireless home system along with our faculties. We've received the Excellence in Education Award by the Midday Group. We've also been ranked by NIRF, which is the National Institutional Ranking Framework. We've been ranked 88th. Our teachers have also received the Best Teachers Award. Dr. Vani, Dr. Gagan, and many other faculties have been awarded with it. Students have received various awards in cultural events, in sports events, glimpses of the same. Our teaching staff. So let me introduce to you our teaching staff. We have almost all the faculties have completed their PhD. 80% of our faculties have more than 10 years of experience. All the faculties have published their research papers in Scopus Index journals. More than 50% of our faculties have industry experience. This is our non-teaching staff. They are actually the backbone of our university. The online courses, we have conducted various online conferences, glimpses of the International Business Conference, which had so many guests come in from varied industries of international business. We also conducted various leadership webinars, okay, starting with Life Skills, a corporate survival kit. We also had, so if you just want to have a glimpse of our webinars, you could join in our YouTube channel, which is DYP USM Webinars. The programs which are being offered at DYP USM, we have BBA, we have MBA, we also have our PhD program. For our MBA, especially if you want to pursue your MBA in core, okay, we have options like MBA into marketing. If you see yourself as MBA into finance, so we also have an MBA finance program into HR management, into operations management, into systems management, into entrepreneurship management. In our sectorial programs, we offer MBA into international business management, into sports business management, health and hospital management, pharmaceutical industry management, biotechnology management, banking and insurance management, logistics and supply chain management, and aviation management. Our inter-college sports events like Colosseum, glimpses of Colosseum out here, our cultural activities, which is Paramount, glimpses of the Paramount. We also have Plantation Drive, road safety campaign, which was being conducted. Drishti, so we want to create a lot of entrepreneurs, especially who are sensitive towards people. So for the blind women, our students went into the blind women of Varangini. They taught these women how to quill and sustain themselves. From Cocoon to Cloth, another project which was being taken in association with our students and faculties in the Vidarbha district of Maharashtra. Testimonials by our industries which are in association with us, like Jaro, who's recognized Rohit Gupta as a career development manager, and they have written so well about him. Sutherland's, okay, Sharayu Smith, he was a management trainee who's been offered in a job out there, and he's receiving a nice stipend out there. Our recruiters, these are the people who believe in us. So we've got various companies whom we are associated with. If you see, every year we have more than 130 companies who come down to our campus, and every year they take up a lot of our students, like companies like Pepsi, Voltas, Lenovo, Godrej, Flipkart, Raymond's, Tech Mahindra, and many more companies. In the banking sector, we've got banks like Yes Bank, IDBI, State Bank of India, ICICI. Most of our students have their internship there, and after that, they also take up a full-time position out there. In the health and hospital sector, we are associated with hospitals like Apollo Hospital, Fortis Hospital, Seven Hills Hospital, Saifi Hospital, Hinduja Hospital, DY Patil Hospital, Kohinoor Hospital, and many more hospitals. Uh, today's webinar, okay, today's web series. So we are going to have this today, that is healthcare transformation, opportunities and challenges. And our speakers are all here set for today's event. Our BBA admission, which is a 3-year full-time program. So if in case you are looking out for any of these programs, pursuing BBA into marketing, finance, international business, banking, insurance, BBA into hospital administration, you can take a screenshot out here. So all our details are being mentioned. We have Mr. Ati Devlekar's number, Dr. Mangesh Zada's number, Vishal Messi's number, and Dr. Sunil Surte's number out here. You could contact any of them from the team, and they will happily help you out with whatever queries you have. The same goes with our MBA program. Admissions are open in case you require any kind of assistance. Numbers are given in below. In case you're looking out for sectorial programs or the core programs, you can contact any of our team members. Thank you for your patient listening. Dr. Sapna, ma'am, over to you, ma'am.
Alpha, can you please stop sharing your screen? Thank you so much, Dr. Alpha. I would now like to introduce to you Professor Dr. R. Gopal. Professor Dr. R. Gopal is basically an engineer from IIT Kharagpur in mechanical engineering. Subsequently, he did his MBA, ICWA, PhD in postdoctoral research field. Professor Dr. R. Gopal is currently the Director, HOD and former Dean of D.Y. Patil Dean to be University School of Management. He has more than 27 years of corporate experience at Bush India Limited, Larsen & Toubro, Tata Economic Consultancy Services, and at Siemens. Additionally, he has more than 30 years of teaching experience in various B schools in and around Mumbai in the areas of marketing, finance, and general management, etc. He was also the visiting faculty in several B schools in USA. In USA, he has conducted several programs on topics like how to do business in India. He has also published more than 200 research papers, both in Indian and foreign journals. He has been awarded the Best Outstanding Research Paper at the Asia Pacific Marketing Conference held in Malaysia. He was also reviewer to several international journals having a high impact factor. He is well conversant with the rules of AICTE as well as UGC rules, also the New Education Policy 2020. He is guide for MPhil and PhD students of several universities in India. More than 100 research scholars have been received their PhD and MPhil degree under his guidance. He is also the author of several books and is a chief editor to several national and international journals of his repute. Additionally, he has written several books in management which have received very good response from the student and corporate community. To name a few books which are published are Marketing Strategy and Application, second edition, which is under Himalaya Publishing House. Case Studies in Business and Industry Management, Indian Context, Himalaya Publishing House. Research Methodology, which is under print. Marketing Finance, which is under print. He has successfully conducted several webinars on topics like impact studies due to COVID-19, National Education Policy 2020, career development, etc. He has also conducted many national and international conferences. The latest has been on the theme Make for Bharat Go Blue. Professor Dr. R. Gopal is recipient of many awards. To name a few is Rashtravidya Saraswati Puraskar awarded by International Institute of Education and Management, Rashtra Vikas Ratna Award awarded by Economic Growth Society of India, Glory of India Award awarded by Indo-British Society London, Rajiv Gandhi Education Excellence Award, Best Teacher Award awarded by Higher Education Forum, Best Management Teacher Award in Management Education by MTC Global and Knowledge Cafe, Educationist Award by National and International Compodium, New Delhi, Star of Asia Award, and many, many more. Recently, MSME Chamber of Commerce and Industry of India, New Delhi has declared Professor Dr. R. Gopal as a Corona warrior. His motto is to transform every student into an achiever so that every student will create a success story. I welcome you, Professor Dr. R. Gopal. I would request Professor Dr. R. Gopal to kindly address the participants.
Thank you, Sapna, for the wonderful introduction that you've done. And good evening to Dr. Nilesh, Dr. Amrish, our chief guests, our students, Shraddha Jadhav and Prabhat, our faculty members, Dr. Sheetal Sainath, Dr. Alpha, Dr. Sapna Suri, all the participants who are there on YouTube, Facebook, and also Global TV, etc. And I also welcome all those sponsors of ours, like the IMC World Trade Center, the MSME Chamber of Commerce, the MACCI, Global Expo, Global TV, etc., etc. Thank you very much for being here and being part of us. Let me begin by saying a few words on this topic that we are having today. And this is a very, very important topic. And that is healthcare transformations, opportunities, and challenges. On a very, very positive note, I must say, I must thank our stars, because the impact of COVID-19 seems to be ebbing. However, this does not mean that we can be complacent. We cannot go lower our guards like the way we did it after wave 1. We need to have an appropriate COVID-appropriate behavior, and we need to vaccinate ourselves. The COVID-19 wave 2 has taken a big hit on the Indian economy. The GDP for FY 2021 has dropped drastically to minus 7.3%. This is the first time it has dropped like this in the entire history of India. But then the economists, the government of India, the RBI, the World Bank, all of them have been predicting that we would grow. Some say 8%, some say 9%, but the bottom figure has always been 8. There's been a lot of stress because of the COVID pandemic, and it's almost now 2 years that we've been suffering. Our friends from the hospital sector and the health sector have done an excellent job in combating this pandemic, and no amount of words can ever compliment them about the work that they have done, and they're still doing. Kudos to all of them. And my sincere thanks to each and every one of those personnel from the hospital sector, the nurses, the patient care staff, the paramedical, etc., etc. Wave 2 began somewhere in January 2021. That's what they said. And the causes are the new variants, no masking, no hand washing, no social distancing. And we've seen the impact of that wave 2, basically. Full partial lockdown, vaccine shortage, ICU shortage, bed shortage, doctor shortage, you name it, all the shortages are there. From a level of becoming a global supplier, we've become a global importer of pharmaceutical products and of the vaccines. Hopefully, as the government of India has promised that by 2021 December, around 216 crore vaccines would be available, which would be sufficient to vaccinate around 90% of the target groups. Some experts have also been talking of wave 3, which is expected in November, December 2021. And just a few days back, the Maharashtra chief minister has talked about wave 3 coming much earlier than even November. There are certain what should we say? There are certain silver linings in a dark cloud that we see. And what are they? The new drug 2G or 2-deoxy-D-glucose anti-COVID drug could be a game changer. Also, the new drug Casivimab-1 plus Indevimab-1, which is a cocktail of 2 SARS-CoV-2 is again something of a game changer, and it is being clinically trialed out in a hospital in Delhi. Zydus coming out with Zycov-D is again something which is unique. Now, all these could be a game changer for all of us. Last year in April 2020, when the pandemic first started, we started a new series called the knowledge series. And the objective of this knowledge series was to do what we as HCIs are very famous to do, and that is spread knowledge on the various aspects. And to that extent, we had conducted almost about 30, 40 webinars. My colleague already talked to you this morning, Dr. Alpha. She talked about the various aspects of the school. I do want to add a few things. And what is that? On the pedagogy aspect, we have modified our syllabus to include the new age syllabus, which is most relevant to Industry 4.0. Dr. Sheetal has also been kind enough, and she's been working tirelessly to modify the syllabus, to bring the syllabus of health and hospital up to the mark in line with what the industry requires. And I must tell you that, I mean, our faculties, we have roughly about 30 faculties, full-time faculties at this point of time. And our faculties would try to always make the teaching learning process more interesting and less boring. They try to make it fun-loving. And to that extent, they introduce techniques which encourage the students to ask questions, to be inquisitive. Students are initiated into various problem-solving techniques, analytical studies, and most important, especially in the pandemic period, to have an emotional stability. And it is not only this, whether you're a doctor or whether you're a non-doctor, non-medical professional, you need to have a holistic approach, because certain things are required today in this. And what are they? Things like good personality development, having a broad smile on your face all the while, in spite of having so much of tension, which means you must have emotional stability, which means you must be happy. You must be able to negotiate, because we are living in a group. And this pandemic has taught us the need for people coming together much more. I mean, there have been a vacuum that was felt by the people and by all of us, because we could not meet our friends, we could not meet our colleagues, we could not meet our relatives. And therefore, that desire to meet together and talk together, helping us each other together, that has developed a lot. We conducted a lot of cultural programs and sports programs during this pandemic. The online teaching process that we initiated last year has helped us a lot. We had earlier introduced a system called the learning management system, through which we said that students would be able to learn wherever they want, whenever they want, whether it's daytime or nighttime. The only thing that we require is a good internet system. That's all. Because our faculties have now started uploading all the lectures. Examinations are conducted on the LMS system and so on. Another very important and very important and very crucial is we have signed agreements with various industrial bodies. And the objective of these MOUs has been essentially to bring about industry-institute interaction. And these industry bodies have helped us to get people to come to our college, to talk to the students on various aspects of the industry, number one. Number two, to give live projects, to give internships, and finally offer them placements. And I must tell you, this leadership series is also part of the industry institute interaction that we are talking about. where we bring in people from the industry to share their knowledge on various aspects. And that's how we have two very great luminaries, Dr. Amresh and Dr. Nilesh, to talk to us on what transformations are likely to take place on the health sector. Our objective has always been to make students employable. And my personal motto has been that every student of mine must be a success story. And to that extent, we've initiated a large number of actions. Under the leadership series we have conducted so far, which began in May 2021, we've been conducting this almost every Saturday. And we've done almost about 10 webinars on various topics, starting from beginner's guide to stock market training, wealth management, global opportunities in pharma, finding happiness, content writing, life skills, supply chain, banking, insurance. How will the industry develop in future trends in HR, etc., etc. Today's webinar is on healthcare transformation, which is another very important. And if you look at it, we have roughly 1.34 doctors per 1,000 people, as against the WHO norm of almost 2. In US, it's 2.9. In Norway and Germany, it's 4+. And the amount that we spend on healthcare is a pittance. It's 1.6% of the GDP. Last year, during the pandemic, the government said that they would increase the MBBS students intake from 150 to 250, and they have sanctioned about 141 new medical colleges. How many of them have come up? I really do not know, because of the plethora of licenses that are required before a medical college comes up. In terms of non-medical, and this is very important because when we talk of transformation, we got to first understand what are the problems that we have. And unless we understand that, we cannot move forward. So I would like to break up into two parts. In terms of non-medical challenges, we have challenges with respect to cybersecurity, shortage of trained manpower, unimaginable patient load, and you've seen that in wave 2. I've never seen that anywhere in the world, where people were carried in auto rickshaws and brought to the hospitals, and people died at the casualty ward for want of infrastructure. And what I mean by that is the shortage of ICU beds, in ventilators, etc., etc. This is something which is I have never seen it, and it gave me a lot of pain, unbearable pain. But for me, the biggest challenge is, if I have a cough and cold, where do I go? There are no general practitioners available today, or let me put it, there are very less number. Everybody wants to become a super specialist. I'm really missing the old timers of the medical practitioners who used to come, have a smile on their face, talk to the patients, share empathy with them, do visits to the patient's house if necessary. And I'm glad to mention it because I'm in the US at this point of time and I'm looking at things. In Los Angeles, for example, you can call a doctor to the house and he would look at you and give you a simple treatment that is required, exactly what the general practitioner does. And when there is a complication, he says, please go to the hospital, super duper hospitals who will be able to help you. Now we don't, that system which is there is slowly dying. And that is something which is really, really, really painful. Second important issue for me is today there's a complete lack of empathy. And I'm repeating again, lack of empathy among the medical professionals. Very few of them have empathy for the patients. And I can name them on my fingertips. Very big issue is the ethical behavior. What do I mean by ethical behavior? I have seen many doctors, many medical practitioners having links with the pharma companies, pathological laboratories, etc., etc. I think we need to change all of this. And the doctors today have got one major role, and that is, you cannot forget it. There are a large number of leading lights in the public figure who talk about vaccine being useless, being not at all required, etc., etc. I think, and this is resulting into vaccine hesitancy from the public side. And doctors have a role to play in educating the general mass, educating people who are in a non-medical field like me, to talk about and telling me that there is a need for getting yourself vaccinated. Medically, I talked about the non-medical part of the whole thing. Now, medically, if you look at it, the world has witnessed a pandemic every 5 years. It could be a financial pandemic like what you saw with the Lehman Brothers in 2009-10, or it could be a medical pandemic. For example, we had in 1988 the hepatitis E pandemic, followed by the hepatitis C. We had the Sabia virus, we had the SAR virus, H5N1 virus, H1N1 virus, swine flu virus, etc., etc. And now you're having the coronavirus. And I see that the next virus which will come up in the next 5 years, because I see a cycle coming in when I do the analysis. It could be in the areas of infectious diseases like Ebola, Marburg viruses. I don't know. I'm just naming a few. But more importantly, I must tell you this, because today, some say that the virus started off in China at Wuhan laboratories. Maybe right, maybe wrong, I don't know. And this virus spread throughout the global world. And China, assuming that that is the cause of this virus, is under pressure. And I think that this is one of the biological wars that is getting started in this country, in this world. I'm repeating again. I am seeing the start of the biological war, and the war which I'm seeing, which we just now saw, was a global war which spread throughout the world. But I think now the next generation will have a limited area-wise biological war. Who will start it? How will it start? Which are the diseases? Which are the viruses? I do not know, but this is what I think will happen in the future. And our medical fraternity, our healthcare systems, our healthcare and hospital systems have to be geared up to tackle this sort of a locally contained virus harming people in that area. And I think this is where we need to look at. There are many, many such issues. There are many, many such issues which are there. And to speak on all of that, we have two very good speakers who are the limelight, who are the illuminaries, and who are the who's who of the healthcare area. One is Dr. Nilesh Singh, and the other Dr. Amrish Sharma. I take great pride in welcoming both of them, and welcome to you, sir. I understand from my colleagues that the registration for this session is around 600-700 or so, and I would require all of them to please put your questions on the chat box, and we would definitely try to answer them. Many of the stakeholders have requested us to consolidate all the webinars so that they can view them at their leisure. We had therefore created a separate YouTube channel called as DYP-USM Webinars. How do you access that? On typing DYP-USM Webinars on the YouTube, we will see advertisements recommended by YouTube. Scroll down and click on DYP-USM Webinars. You will be directed to the home page. Click on the videos and you can see the thumbnail of all the webinars that you have. And I would request then for you to please select that webinar where you want to see. I would request all of you to please like, share, and subscribe to these videos, because there is no cost in subscribing, but it helps us in understanding the profile of the viewers who are watching the YouTube. And finally, my last statement is, please, all those who are eligible, kindly get yourself vaccinated. Don't go by the false statements that are coming up. We've got to beat this coronavirus. And I think we can do it. And therefore, please vaccinate, and follow COVID appropriate behavior. And if we can do that, I think we can beat the wave 3, the Delta variants, and if there are any more wave 4, wave 5, I do not know. Yeah. So thank you very much, and God bless all of you. Thank you, and welcome both the guest speakers that we have. God bless you also. Thank you. Sapna.
Thank you so much, Professor Dr. R. Gopal, for your valuable thoughts. I would now like to introduce to you Dr. Sheetal Naikwade. Dr. Sheetal Naikwade is currently as an associate professor in D.Y. Patil Interview University School of Management. He is also a course coordinator for BBA Health and Hospital and MBA Health and Hospital Management. He is a point of contact for BBA and MBA admissions in health and hospital industry. He is also taking care of live projects and hospital project study for both the courses, assisting students in final placements of hospital management students, arranging national and international conferences of healthcare. I welcome you, Dr. Sheetal. I would request Dr. Sheetal to kindly address the participants.
Thank you, Sapna ma'am, for your kind words. And I would like to thank Dr. R. Gopal sir and Dr. Vani ma'am for giving me this opportunity to lead this webinar on through the online platform and on healthcare transformation. Very good evening, one and all present here. So today's theme is basically on healthcare transformation. So as we all are aware that transformation itself is an ongoing process, right? So like whenever something ordinary is there and some extraordinary is happening, that time transformation is taking place. So right now, during this current pandemic situation, we could see and we could feel the transition phase of transformation. And I think we are going through a transformation that everyone all over the world is becoming health cautious, and hence we are stepping and moving forward to the transformation. Like since last decade, we could see and we could feel the healthcare transformation which is happening in and around the world. So include like all ordinary people of all the countries as well as the healthcare professionals have gone through the transition phase, and this kind of pandemic situations and disasters which we are facing, that could be one of the emerging trends in the healthcare industry. So we as a healthcare professional, I can say that over the last few decades, India has also done like many significant advancement in the way where the healthcare delivery is happening through the private healthcare sectors and public players as well. And in terms of employment and revenue, like this is healthcare industry is one of the largest sector and is growing at a break pace. So there are some emerging trends in the healthcare transformation, such as advancement in the technology, medical infrastructure. You can see like advanced medical equipments are coming, robotics is coming in the healthcare, then artificial intelligence is coming in the healthcare. So that digital transformation is happening in the healthcare sector as well. And as well as like healthcare insurance awareness is like nowadays during this pandemic, we could see the rise in healthcare insurance as well as medical tourism and telemedicine. So the future of healthcare is going to focus on taking patient-centered care model to the next level, where the healthcare delivery is moving away from quantity or fee per service or out-of-pocket expenditure. Then that the approach is towards nowadays to the value-based care, which provides incentives for good health outcomes, as well as the healthcare organization, they need to increase their data management, then increased interoperability and better ways to measure the outcome, as like whatever healthcare delivery these healthcare organizations are doing, and they can improve to and build on organization that delivers the healthcare and quality experience of the patients to whom they are serving. Hence we can say that the with the advancement in the current era, like we have seen the one since 1.5 year we are everyone is facing this kind of challenge, and many more challenges are coming in, where the healthcare professionals have to face these challenges, and ultimately the opportunities would be available for all the students, those who are the part of healthcare sector. They'll be getting definitely much more opportunities. And here I want to say that the change is inevitable, but the transformation is by conscious choice. So I don't want to take much more time, and I want Dr. Sapna ma'am to come back, and we shall welcome our esteemed eminent speakers, and we should start with their sessions. Thank you, Sapna ma'am.
Thank you so much, Dr. Sheetal, for your thoughts. I would now like to introduce to you Dr. Nilesh Singh. Dr. Nilesh Singh has vast experience in the hospital management. He has more than 12 years of experience in different verticals of hospital industry. Currently, he is working as a senior manager administration Wockhardt Hospital, which is located at Mira Road, where he takes care of operational efficiency and business development. Other than this, Dr. Nilesh had worked with Asian Heart Hospital, SL Raheja Hospital, Asian Heart Institute of Oncology, etc. And being a medical person, he has clinical experience. His areas of experts, he has done MBA in Health and Hospital Administration from D.Y. Patil Deemed to be University School of Management. He is also our alumni. He is CAHO certified professional for quality implementation in hospital, implementation of NAM, pre-accredited entry level standards in HCO, Green Belt Lean Six Sigma certification in the year 2018, QCI certified NAM internal assessor training from AQL Consultancy Kolkata in internal audit. He has also attended a workshop by NAM on legal compliances in a hospital in July 2012. I welcome you, Dr. Nilesh. I would request Dr. Nilesh to kindly address the participants.
Thank you, Dr. Sapna. And it's good evening, everyone. Good evening, Dr. Gopal sir, Professor Dr. Gopal sir. It gives me an immense pleasure to share this platform with my mentor, Dr. Gopal, whom we have been looking forward always to fulfill our dreams. Dr. Gopal has been one of the person to push us to our limits so that we can explore our qualities, and then we can excel in our careers. Thank you, Gopal sir, for pushing us. Special thank you to D.Y. Patil College of Management for I can proudly say I was the second batch from D.Y. Patil College of Management for Healthcare and Hospital Administration. But the confidence what Dr. Gopal built us on the day one of his address, I still remember, sir, the terrace in where you address the entire crowd with the entire confidence and the, what do you say in Hindi, call it Josh, what, at that stage, it gave us the entire confidence that yes, we can, we came there with few dreams. We wanted to fulfill our dreams, starting from our clinical aspects. We wanted to move on to non-clinical. But thank you once again, Dr. Gopal and D.Y. Patil University for, allowing us to try to fulfill our dream. And it's all because of them we have reached till this. And our endeavor will always be there, sir, to make you proud and make the college proud that, that yes, we have been an alumni of D.Y. Patil School of Management. I would especially thank Vani ma'am. Ma'am, thank you. We have learned a lot from your, around 8-10 years back from your classes and lectures and everything. We still remember, you pushing us to do our daily work what you were supposed to do, and probably we were one of the naughtiest class which you have got, but still I'll thank Dr. Sheetal to give me opportunity to come to this platform. I would special thanks Dr. Sheetal, to inviting me to share my thoughts on this topic. My first question to Dr. Sheetal was that what do I share in this topic, but I feel, yes, being in the front line, being as the frontline worker fighting this COVID pandemic, it is important for us to share our thoughts, what challenges we faced, what are the opportunities we look forward, and what has been transformed from a routine healthcare management system to a newly digital world of healthcare management system and opportunities. As rightly said by Dr. Gopal, sir, this COVID pandemic has definitely pushed all of us to all our limits. It has put us to a lot of health challenges, lot of other challenges in which includes mental distress and other stress like well-being of your near and dear one. Many people have lost their near and dear one in this COVID pandemic. But yes, it has taught us also a lot of other opportunities and other things in this pandemic. How to survive in this pandemic has been taught by this pandemic. I would not take a lot of time. I would, like to share my some views. I would share my presentation with the team. Is the presentation visible? Is it visible with the presentation visible?
Yes, it's visible.
So we'll start with the healthcare transformations, few opportunities and challenges in this pandemic. First, we will start with the current scenario. We would definitely, talk about the pre-COVID scenario, what we were actually, because that will actually give us an idea what has this pandemic pushed us and where is this pandemic leading us and how it has transformed our healthcare delivery system in India. Healthcare delivery system in India was a very robust, a very old school delivery system. In India, we were still continuing with the various national health missions and other schemes by the government. Private sector used to fill a major part of the healthcare delivery system into giving tertiary care. So what was our healthcare scenario in pre-COVID pandemic? So we at India used to think that, yes, we have achieved everything. We are one of the best healthcare system in the entire world. The entire world is looking at us to deliver a lot of good clinical care at to the patient. So we used to, please do not take the picture literally by the meaning. The basic idea to share this picture was that we, at the healthcare scenario, pre-COVID era, we were more of like, yes, we can do everything. We can treat everything. We can tackle all the diseases. We can tackle all the health scenarios coming to us. We were one of the preferred destination for international marketing. A lot of countries' patients used to come to India in order to get their healthcare treatment done. So healthcare scenario pre-COVID was like, yes, we can do everything. We can deliver everything. Then came the era of COVID pandemic in 2020. What did COVID pandemic do with us? Where did the COVID pandemic in March 2020 leave the healthcare scenario and infrastructure of India? We were actually caught unaware. We were caught unprepared for healthcare and for such a type of pandemic. We were never prepared to take care of any pandemics because the healthcare infrastructure in India is totally diversified, starting from urban healthcare to rural healthcare. the entire scenario in urban as well as rural healthcare is totally dynamically different. So what were we left with? The entire healthcare infrastructure in COVID first wave, we were caught basically sleeping. We were not ready. We were not prepared. We never thought that, yes, India will also face such a big or such a massive pandemic, and we will also face such a big disastrous pandemic and people getting sick. So actually our healthcare infrastructure went on ventilators. We were left unaware. We were left unprepared. We didn't have answers to our questions. No one knew what COVID is, how to take care of the COVID, how to treat it, how to take care of the people in the who are getting sick. We were always looking toward the West and the European countries to teach us how to take care of the COVID scenario. So we will take you, I'll try to take you around the actual COVID current scenario, what we are facing. In India, we have yet, our second wave is still going on. We were actually having a peak of 4 lakh cases per day around in month of May. Now it has come down to around 45,000 cases per day, but still the second wave is not yet gone. It is still there. We are still struggling with it. So globally, pandemic has peaked in many countries. Various countries like US, UK, Israel have come out of their waves. Smaller countries like Thailand, Vietnam have managed to control the pandemic. But what happened at India? What did we do? Why are we not able to control? We have become the second highest number of daily cases coming in of COVID, still measuring hovering between 45 to 50,000 per day. We are second next to US in the number of cases infected till date. We have the second highest number of deaths in India. Around 4 lakh people have died due to COVID-19 till date. Most of our COVID incidences were previously what we thought about was located in urban areas or urban cities. But the second wave took us for a shock, took us for task that no, it also spread to the rural areas. As I told previously, our healthcare scenario was more concentrated towards the urban areas, and our rural areas were not having much of the infrastructure and much of the healthcare facilities available. Transmissions also picked up during the lockdown. One of the strictest lockdowns we faced in the first wave. Second wave was also one of the strictest lockdown which occurred during in Indian scenario. So what are the challenges what we faced in this current scenario? First wave and the second wave. The first and foremost challenge what we faced was the lockdown. Lockdown means everything was shut. We were not aware about, we didn't have our supplies. Supplies, I mean by medical supplies. We didn't have infrastructure. We didn't have manpower. There was acute scarcity of manpower. Manpower, I mean skilled labor, which includes doctors, nurses, as well as the other non-clinical staff. In India, we never invested on something called as building up of capacity into skilled manpower. During the COVID pandemic, we were also caught unprepared for staff per se. We didn't have staff or we didn't have manpower to handle this amount of pandemic. As Dr. Gopal said, the number of beds capacity in India is around 1.2%, which as per the WHO guidelines, it has to be 10% minimum, 10 beds per 1 lakh population, which we are currently at 1.2, which is very, very less. So we were unprepared. Our models or our care plans for patient were all rudimentary, were all guided since past 50 years. We were following the same. We never innovated. We never changed. We completely followed the same plan. We kept on, we had the same that the patient will visit. We never concentrated on communicable disease management of diseases. We always looked upon various national health programs, which were like TB, pulse, polio, and all those things. But our focus towards communicable disease were never focused approach. So we were caught unprepared at that time. The healthcare staff had tremendous physical and mental stress. I literally mean physical and mental stress. I can share my own experience with everyone that we were scared to go home. We used to feel that because we have our near and dear at home, we were scared to reach home. Probably we carry the virus at our home. But yes, still we had to fulfill our responsibilities. We cannot shy away from our responsibilities. We had to come to our hospital every day, manage all the patients, manage the relatives, manage the challenges every day. But the mental stress and the physical stress during this lockdown, which was carried, is tremendous on the healthcare staff. Other challenges which were faced during these COVID pandemic and scenarios were like there was acute shortages of supplies. How do we treat patients? We cannot treat patients by hand. We need equipments, we need medicines, we need protection, we need PPEs. We were thrown into light where we did not have even PPE for our regular staff to go and treat and meet the patients. Adequate supplies of medicines, essential medicines, oxygen were all hampered. Other than all these things, we had tremendous financial losses which were faced not only in healthcare, into other sectors, which made it actually not feasible and a non-viable thing for the normal public. Hospitals also faced other problems like the elective cases and the routine care. A planned routine care of the hospitals were taken for a toss. It was not allowed. It was not, people were scared to come to hospital to do any elective cases in a routine case. So how do the hospitals survive? How do the hospitals take care of their expenses? How do they take care of the patients? So this was a challenge which was faced in the first scenario, first wave, and even in the second wave. This is what every one of us faced. When we moved out of our place, we all were scared. What will happen with us? What damage did COVID do to us? 90% of our ailment, which we used to seek, were totally shut down. PMJY utilization of various data showed there was a decrease in 64% of PMJY utilization. Rural healthcare went for a toss because the TB cases notification in April 2020 went down by 84%. It does not mean that the TB has gone down, but people are scared to come to hospital to report for TB. One of the recent studies shows that in coming year post this COVID, we will have a surge of TB cases as people will come out with various non-MDR cases. What happened to our economy? Our per capita GDP projected decline was -6%. We went down to even -11%. Economic cost of COVID-19 in India was huge. People were thrown out. People didn't have jobs. People didn't have work. Daily wage workers were thrown out of work. They didn't have their livelihood. What did COVID do to healthcare system? Why were we caught unaware? We were not prepared for COVID because India does not have actually a robust health for all system. Our still spending in India for more than 50% is from the public's out-of-pocket spending. What do we mean by out-of-pocket spending? Basically, if 100 rupees is spent in India on healthcare, 60% is almost spent by people from out of their pocket. So during this pandemic, what happened? People went out of jobs, so they didn't have basic healthcare facilities to spend for. Public financing was stopped. what happened to our poor quality of care? There was no structural care. We didn't have isolation rooms. We didn't have rooms. A per capita requirement per bed is around 150 square feet for each bed between in a hospital. That's a norm by various quality schools like NABH, WHO, other, they have this norm. But in India, we do not have such good structures. We have these small nursing homes in which we are cramping into beds where one patient is touching the other. So how do we take care of these challenges which were thrown at us? Because of all these structures, the healthcare structure started collapsing. Also there was there is difference into a huge quality of care into various states in India. For example, if we take, the quality of care is concentrated at various urban cities, like you take metropolitan cities, Mumbai, Hyderabad, Bangalore, other various metropolitan cities there where the 60 or 70% of the healthcare private sectors are concentrated. What happened to the rural healthcare? So what are the opportunities this healthcare brought to people? We could not meet, as Dr. Gopal said, we could not meet our people. We could not even meet the patients. Patients who wanted to have some disease, they could not come to the hospital because they were scared. So how do we deliver our care to patient? How do we start delivering our healthcare? So this is what COVID or a pandemic gave to us. It gave us an opportunity to explore and to change the actual way of delivering of healthcare in India. We started thinking digitalization. So if we see, our healthcare has now become digitalized. Our healthcare has reached to core houses of people. Healthcare is accessible by people by ways of digitalization, by various telecommunication, telemedicine. Our various telemedicine is now also been incorporated as a part of normal care to be given to patients. Previously, telemedicine was not a part of, it was not legally allowed in India. But now there are guidelines which have been framed to do telemedicine, to give healthcare to doorstep of people. So what opportunities did it throw to us? It made us digital India. Our healthcare systems went into digital India. We could digitalize our healthcare to reach to homes of people. Today, if a person sitting into rural India, if he wants to have access to a good healthcare professional, he can now have that access to that healthcare advice, which previously they were deprived of. So what all good things did we do? We connected the entire country by various applications. Arogya Setu app developed by Government of India. It gives you an opportunity to access your own health every day. It connects you, it gives you an access to see which all labs you can access. Vaccination drive, one of the biggest vaccination drives done in entire world. I can proudly say that yes, we are one of the highest doing vaccination drive in India compared to our population. What drive we have been doing and we have been conducting is a massive drive happening, and I am proud to be a part of it. Now healthcare for all, including the rural India, has started developing. We have started connecting the rural India with the healthcare facility by remote consultation. Previously, healthcare was concentrated at one point, but now we have started implementing the idea of decentralization. We had first centralized care. Now we are getting into decentralized care. So just on the lighter side, who led your digital transformation? It was no CEO, no CIO. COVID-19 made us to go digital. it pushed us to become digital. It pushed us to get connected. Various artificial intelligence are now used. We can now predict whether we will have third wave or not. So if we divide opportunity for healthcare system, we can probably divide it into 4 basic points. First and foremost, most important point is health financing. As Dr. Gopal pointed out, our GDP spending on a healthcare finance our total spending is currently 3.5% of the entire GDP. If you see the image, US is spending around 40% of its GDP in healthcare. We have not even reached, the desired number of what we should spend for improving our healthcare. Private financing yet in India plays a very important role in delivering healthcare in India. So what should we do? At 1% of GDP, Indian government health spending is among the lowest in the world. If we take it actual number wise, it might be huge, but the actual GDP as compared to our population is just 1%. In 2017, when this government came up, they pledged to do 2.5% of the GDP to be spent till 2025. In 2020, a huge chunk of our spending was reserved for healthcare, out of which a major part was kept for vaccination. So that's a positive point. That's a positive thing which the government is now looking for. They are looking for spending. They are looking to improve the healthcare structure in India. They are looking to diversify the healthcare, what we were previously, and they want now to change it to decentralized structure and build more and more and a better structure of healthcare. Healthcare was the lowest priority for everyone. India ranks 175th out of the 190 countries in budget prioritization. So I only don't mean that we should only spend more. It's not about spending more. It's also about how do we spend and where do we spend. We have been spending only building the rural healthcare, primary healthcare. But COVID showed us that we need to employ more also for a tertiary care setups. The entire rural India in the second wave had gone for a toss. People had to travel 400 kilometers to have a good tertiary care treatment, basically. And the entire load on various few cities and few states had to bear the entire burden. So now what we should do, what we should look for, we should look for resource mobilization. We should try to have more and more resources into various areas. We should not only look, just spending onto a particular thing, but we should prioritize where we should spend. So something called as risk pooling should be done. We should prioritize the risk where we are going to probably, what is the risk what we are going to face in coming 10 years. Our purchasing should be very efficient. It should be, linked basically to our requirement. It should not be just linked to, yes, we have to spend, so we are purchasing. No, it should be linked to our requirement, what we require. For example, ventilators was the need during this COVID pandemic. But in the entire country, we were short of ventilators. We did not have the basic life support medicines or the life support instruments or ventilators to be given to people. So this is what we mean for spending, efficient spending. So we have a lot of scope. Resource allocation formulas are there. We should ensure that better service delivery in public and private investments. So public and private, they both should come together and they should work together into giving care to patients and care to people. Now we take to the second point, that is the service delivery. we were rudimentary in our thought process. We always thought we had always a very focus, had one thought process that we will follow only this structure of our healthcare delivery. But COVID made us to think different. If we take, our focus was always on a reproductive and child health. But now COVID made us to think, no, chronic and non-communicable and communicable disease is also something which we should look at. Focus on access to care. People in rural India did not have access to care. They do not have access to good healthcare. Whereas the healthcare is concentrated into various few cities, few areas. So it made us, now, since we had lockdown, people could not travel. They could not get access to these good setups. They could not get access to good quality healthcare. So it makes us to think that we should now diversify from concentrating our resources to going to various rural tier 1, tier 2 and tier 3 cities also. We also only have accounting, but we do not have accountability. People should be made responsible for their deliveries. We always see that, there is so much of spending into rural health mission and everything, but the actual on ground is something else. The entire healthcare system in India was paper-based, but now we need to go digital. Okay, we only had headcounts for healthcare workers, but this COVID pandemic, as Dr. Gopal said, we need to increase our strength for doctors. We need to increase our medical colleges. We should increase our healthcare professionals who are the need of the time, because they can deliver good healthcare. We should focus from urban to we should go to rural. So what do we mean? I would like to coin one word called as open source actually. Our healthcare delivery was always, we tried to implement that everything will be similar in the entire India, that if, yes, the healthcare mission, if it has to be at one state, it will be implemented similarly at every place. But no, India is a diversified country. Various states have various requirements as per their GDP spending, as per their income, as per their crowd and their population. So one solution will not fit all. So we should have open system in where there has to be different solution to be implemented in different places. So the system which worked in Mumbai probably might not work for, remote places like Assam, Arunachal Pradesh, few parts of Bihar, Uttar Pradesh. So there has to be a different model or a different innovation structure which should be taken care, which should be implemented there. We should empower people at different stages. The structure in India is from top to bottom. The entire power center lies in the top. The lower people do not have powers to implement, but that should change, because those people on the ground, they should have the power to implement as per the requirement of their place and their area. We should have a 7 shift, accelerated by during COVID. So I tried to jot down, a few points in which we should try to innovate. So we should have a distributed system of delivering healthcare. Distributed does not mean that we should not be connected. We should be connected. We should have a common database. When COVID came, what did COVID did to us? None of us were aware what is COVID. How do we treat COVID? How do we take care of the infectious nature of this virus? This virus gets mutated and it is changing. So we should connect to each other. Like if Delhi, for example, is facing a Delta plus variant surge, the knowledge imparted from that area should definitely be connected to other states and other cities to impart knowledge and to implement those things. So this is what COVID has got to us, to get connected through digital medium, to connected to various AIs. Our reforms should be continuous. It should not be for particular some period of time. COVID has come, probably after some few years, COVID might come down. I don't know. I'm not the right person to comment. But yes, it might come down, but something else will come. So we should be continuously innovating. Innovation is the answer to any pandemic. Keep on thinking new innovations and new things should be implemented. Our innovation should be human-centered. As I've been telling, we should decentralize our structure rather than being centralized. We should be collaborative. One state should collaborate with other. If one state has got a problem or one hospital has got a problem, they should collaborate with other to share their resources. We should be responsive. We should respond to the need of the time. Third and fourth are all connected, public health and core hospital service. It should reach the rural population. Healthcare infrastructure should be for all. So what did this pandemic do to us? The pandemic did to us that, we didn't have healthcare infrastructure. We didn't have structure to test our people. Our healthcare load on the RT-PCR, we used to get one report after 4 days. So our infrastructure was there was no infrastructure. So we should start building our capacity, capacity to test our people, contain our people, to give them the best of resources. So key messages, what COVID has given us. Indian health system has made significant progress in global perspective. We have been uploaded by various countries in containing this COVID pandemic. We see that, yes, we had the highest number of patients coming. We had 4 lakh patients getting infected at one given point of time. But we also have to understand the amount of people whom we are catering to, or the amount of population to whom we are trying to contain as compared to other countries where the population is less. The resources to these populations, what we are trying to is a huge task which is being done. So our various models have been appreciated by various countries, but yes, this should be a continuous model which we should try to implement. We should build up a healthcare system for 21st century. We should not build up a healthcare system for now. We should keep on innovating and build up a healthcare system which will fit after 20 years, after 50 years, which keeps on changing itself, by the learning what we get. So a short summary about what we discussed, what we spoke about. First and last, I would now try to thank, all the healthcare workers, the doctors, the nurses. Believe me, the doctors, nurses, healthcare workers have been working very hard. They have put their lives actually, on risk for us. There have been deaths happening. I take this opportunity to thank my co-colleagues, co-doctors, nurses in this hospital who have been working tirelessly to treat and to keep ourselves safe. I would end this session by saying, please keep yourself safe, get yourself vaccinated. Please keep your near and get everyone vaccinated and stay safe. Thank you. Thank you, everyone.
So much, Dr. Nilesh Singh, for such a valuable thoughts on challenges and opportunities. Now, I would like to introduce to you Dr. Amrish Sharma. Dr. Amrish Sharma is having enormous experience in the healthcare industry. He has worked with some of the most prestigious organizations like Fortis, UNICEF, Apollo, etc. Basically, he's a medical professional. He had done his graduation in homeopathy, and then he's also our alumni. He has done MBA in Health and Hospital Management from Gita Patil University School of Management. He is currently working as a Director Operation and Strategy in Apex Group of Hospitals. Other than this, Dr. Sharma is having enormous experience of hospital planning and management consultancy, where he's a very short period of time he reached on the peaks of hospital consultancy and working as one of the most promising hospital consultants of the country, where he has spearheaded more than 100 healthcare projects in public-private sector and at international level, that's from project feasibility till commissioning. He has executed projects from organizations like Ministry of External Affairs, Ministry of Commerce, ITC Group, KPMG, Deloitte, JSW Steel, Government of Madhya Pradesh, Government of Maharashtra, and National Health Mission, etc. He was awarded for his extraordinary performance wherever he has worked. He has been invited as a speaker panelist in various conferences like Healthcare Knowledge Forum 2016, Siliguri, Symposium of Future of Healthcare in BKC, Mumbai 2015, etc. I welcome you, Dr. Ambrish Sharma. I would request Dr. Ambrish to kindly address the participants.
Thank you, Dr. Sapna, for your kind words. I would like to congratulate DY Patil University for conducting this leadership series, and also like to thank Dr. Gopal. Whenever we see him again, we feel motivated, and it's always nice to back to have association with the DY Patil group. I would like to thank Dr. Sheetal, who has been in touch with us during for this program. I will just connect you with my presentation.
Have you minimized the presentation and kept it on the desktop, Ambrish?
Yeah, it's there on desktop only.
Just click on share, then probably you will be popped up and taken to the screen, and then just click on the presentation. Just click on the share button, share screen. Can you see down where all the captions are there, polls? Besides that, it is share screen.
Yes.
Yeah, just click on share screen, then probably you'll be popped up and taken to the new tab, and then
No, I think I'm not. Yeah. Can you see?
Yes, yes, it's visible.
So am I audible?
Yes.
So I will just run through to all the attendings to healthcare transformation and opportunities and challenges. So if you will see, the Indian healthcare mostly comprises of hospitals, diagnostic centers, pathologies, medical equipments, then medical tourism, pharmacy, telemedicines, etc. In hospitals, all the three sectors which I considered, like public health, then your medical institutes, and all the nursing homes and the big hospitals which comes under that. Diagnostics is the another thing which has shown tremendous growth during COVID also, and before. And if you'll see from last 10 years, there are so many chains which has come up, and then they are doing good business, and it's become a big vertical itself. The pathology is the part of that. The medical equipments also means, if you can if you'll see the technology which it's become very advanced, the CT scan, the MRIs, the robotic care, and all these things which recently comes under the advanced care of treatment. The medical tourism part, if we'll see, there are almost 40 countries around the world from where the patients are visiting to India to take the medical care because of the cost also and the quality which they mostly believe. Then in medical tourism, India comes under at number 3 in Asia after Singapore and Malaysia, that the most number of patients are visiting to India. All this has impacted because of COVID right now. And if we'll see the major cities like Delhi, Bombay, then Chennai, the almost 30 to 40% of the revenue is coming from this segment, the medical tourism part, which is right now it is highly affected. There are so many pharmacy chains and initiatives which has come from last 10 to 15 years. The telemedicine already, Dr. Nilesh has covered this topic. So the telemedicine also means the people are not means they are scared to visit the hospitals right now, and they are seeking for treatment from their home. And for the rural area also, this is the major drive which is rightly going on. If we'll talk about the healthcare sector industry, it's the second largest service sector industry in India. From last 10 to 15 years, the paradigm is shifted, and then there are so many advancements and the changes has happened. It becomes from unorganized to organized and structured sector. If we'll say that it was earlier seen only a social sector, but now moved towards the corporatization. In 1982, the Apollo has started their first corporate office, and from there, the corporate trend has started in India. And now it's like other business and hierarchies, the healthcare is working in the same way. Other than that, means there is lots of investments which is coming up in healthcare from the banks, from the private equities, from the investments, and from the international players also. There are so many. We have seen recently that there are so many healthcare chains which were acquired by the international groups, and lots of investments are coming in. Post-COVID, it's the healthcare is looking like very lucrative market and the safe investment what the people is thinking right now. If we'll see the healthcare sector prominently dominated by some of the corporate healthcare brands in India, like we'll see the Apollo has almost 48 hospitals and they're running with almost 10,000 beds all over India. The Fortis is the second. They have almost 36 hospitals in India. Manipal with 16 hospitals. The Narayana, they have 24 hospitals. The Max Healthcare, they have 16 hospitals. The Care Group, they have 14. The Shelby, 11, and they all are during this pandemic. They have become their speed is slow to come up with the new hospital, and they are holding the investment. Other than that, there are other upcoming hospital chains which are eyeing, and then probably in next couple of years they will come up with the new chains like ITC. They are planning to come up with almost 5 big hospitals. I was privileged to be part of their Delhi hospital, which they are coming up with a 500-bed hospital. Post that, Vedanta is planning to come up with the chain hospital. The Indo-UK, this group has already started hospital in Patiala, and then they are looking to come up with in Nagpur with the other hospital. Omega, they are coming with the oncology chain of hospital. The world, one of the best and the biggest brand in healthcare, the Cleveland Clinic, they are eyeing to Indian market, and they have already started studying the possibility of opening a hospital, and they have visited to Bangalore also. I was privileged to be part of their earlier discussion, and then it's the project is under the process right now, and it's a it will be the another means the scale which the Cleveland work and the hospital which they drive is it's unimaginable. Right now we don't have any such facility in our country, despite of the big hospitals we have. If we'll see the major stakeholders in healthcare, so in my view, the healthcare sector is it's divided into three parts. There is a public healthcare system, there is a private healthcare system, there is a there's a teaching institute. So in public healthcare system, this mostly work with the Indian public health standards. It's IPHS norms which follows under that. Under that, there are sub centers which they plan and they come in with the population of 200 to 300 people in the small villages in the rural areas. Post that, then there is a primary healthcare systems. So around they come up with to 3,000 to around 5,000 population. After that, there is a community healthcare systems. So more than 10,000 to, if you can see, up to 40,000, this hospital setups were there. And this up to the taluka level, this some sub-centers to community healthcare centers, this generally this type of systems work in the rural areas. Post that, the district hospitals come. So district hospitals, by the name itself, it's into the district of that location. So if we'll see this sub-center, primary or community health center, so this may cover up to the population of 2 lakhs to 10 lakhs, and they don't have any tertiary healthcare facility up to that level. And even in district hospitals, means I can share my experience when I was with the UNICEF earlier. Means today we are talking about ventilators, oxygens, the scarcity, and everything. But I have seen the time where this public health hospital up to the district health hospital, they are not aware to operate even the oxygen line at that time. Means they don't know how to put the mask. So we have trialed it, and then we have seen that. The other part is that the critical care which they are offering, the OTs which they are managing. So it's very challenging for them because of the environment, because of the scarcity of the resources and all the issues which they are facing. They have fund, means we are again and again hearing that the investment in healthcare is not up to the mark and comparing to the other countries, but they are getting funding, but not only from the government, but there are so many other NGOs and agencies from where they are getting funding. The World Bank is funding. There are different groups like UNICEF, WHO, and there are the local NGOs. There are other programs also which are giving continuous funding to that. So that was not utilized opt and up to the mark, and because of that, the government system, the healthcare system, is always on the toss. Other than that, there is a private healthcare system where the nursing home councils work. Their NABH and JCI standards comes under this. All your clinics, nursing homes, private corporate hospital, trust hospitals, home health care, all this comes. So this is entirely different from the public health, our private healthcare system. There is no similarity if we'll talk in terms of the operating and the operation part of that. The other thing is the teaching institute, which is more mostly governed by MCI, which is right now become the National Medical Council. So the medical colleges, they follow the norms of MCI, and it requires a big campus, and they have their own norms with the medical college and the hospitals which they are running. So these are the basically the three healthcare structures which our countries follow, and then under this everything comes under these three heads. If we'll see and talk about the transformation in the healthcare, you can see the infrastructure pictures and the photos which I'm showing right now with you. So look at the infrastructure. These are not the hotels, but the hospitals. There is a big investments which comes under these things, and then because of all these things, the healthcare, see the government set up also the infrastructure and interior. So this is the biggest, one of the biggest transformation has happened from last 15 years, where the interiors, the infrastructure and technologies, people are investing in that, and the cost of healthcare projects goes up to the Everest project is coming from 100 crore to 1000 crore, which right now the hospitals, which in Bombay also there are some of the hospital which they have invested, the private group has invested almost 700 to 800 crores for a hospital. We can say this one bed cost in a city like Bombay goes from 70 lakhs to 1.5 crore, depends on the location, where means all the high interiors and the medical equipments which comes to play major role. We can see the advancements in technology, the robotic has come. This is the another thing which from last 7 to 8 years, most of the hospitals, they are operating with this technology. We can see the CT scan has come and reached up to 250 slice. There is a proton beam therapy, which in India, the Tata is planning for one, and the one is at Chennai, which Apollo has started. So the investment itself is almost 300 to 400 CR to open such facility, and then means this can cater not only to our countries, but they are getting the patients from surroundings. We can see the radiation therapy. There are lots of onco chains which is operating in India right now, and then they are expanding on very fast pace. Like SCG is there, Indo UK or Indo US Healthcare was there. Then Omega is there, which they're coming with, and they have opened almost more than 50 hospitals around the country with this for the cancer treatment. Other than that, our Indian chains have moved to outside India also, and to these SAARC countries also. They have open up the hospitals. We can see that other than that, like advanced version of the ventilator in there are the cardiac care also, that the cath lab and all this technology has emerged. And then it's earlier it was very difficult for the small setups, but right now each second hospital they are running with cath labs and the other cardiac technology. So there is another big transformation in healthcare. AI comes into the picture. If you can see, the RPA, robotic process automation, is already there. The telemedicine is there. Then hospital management system is also become very advanced right now. This, most of the corporate hospitals right now, means especially this chain where the hospitals are more than one, they are working on this artificial intelligence data, and then on this RPA, and they're getting good results out of that. If we'll talk about the health insurance, you can see only 44% of Indian population is having health insurance. In that also, after coming this Ayushman Bharat of the Modi government scheme, this percentage, if we'll include that, that is become 44%. And if we'll see only for the private insurance segment, then this was that was reached up to 15 to 18% right now. The rest is the government scheme. There is Ayushman Bharat, the PMJY schemes, and all these schemes come under that. Like different states operate their own schemes, which all clubbed into this. And if you'll see in the rural areas, there are almost 95% population have privilege to access these schemes, but they have limitation and capping. And this tertiary care or the star hospitals, which were in the big cities, they are not accepting this scheme because of the rates which they are offering. If we will talk about the models in healthcare, earlier there is only 2 or 3 healthcare models which are working in public sector. That was mostly governed or run by state government, and there are hospitals which runs by central government. And if this medical college comes, so there is a medical education system which under that all this comes. Other than that, right now there are so many healthcare and business models which emerged in last decade. There is ownership thing, the partnership model, where group of doctor is coming with the hospitals. There is public-private partnership, PPP, where means we can hear routinely and regularly this word, where where there is so many hospital projects with the government and private player both are coming into the picture, and means this models works like that, like government is giving infrastructure and all the land and everything to the private players come into that, and then take care of the operation part, the manpower and all these things. We can see that one of the PPP is the DY Patil is also running like right now with JNPT. They have acquired that setup and they are running at Badala under this PPP only. There are joint ventures where one party invests in certain parts, like they invest in the building and infrastructure, the other party invests into the equipments, and like that they become the joint venture. There is a lease rental models, so it's a asset light model where means right now most of the hospital new chains, they are working in that way. Earlier what is happening, they are purchasing the building and then they are operating it. So this take time. If someone is if I will simplify to this process, then there are two type of hospitals. One is the greenfield and other is the brownfield. The greenfield is when the hospital, when you have a land and you have to build the entire hospital, that called as a greenfield setups. And then when you have already existing building and then you have to convert it into the hospital, then it's a brownfield project. So under this means this greenfield hospitals take always means if you want to build a 100-bed hospital, it will take minimum, it will take at least minimum 2 years of time to come up with that hospital. And same with if it's a rental building or some existing infrastructure, you just need to convert it. It will, you can start a hospital in 6 months. So you can save the revenue loss under this scheme, that under this model in the lease rental. And most of the chains and the hospitals, they are coming and growing in a very fast manner because of this lease rental model. If we talk about the opportunities, then healthcare is considered as a recession-free industry, which was proven time and again in this COVID also, when the most of the industries were bleeding and then most of the business got shut down. The healthcare has still managed to survive and done great job in the COVID. Despite of all the odds. If you can see the union budget in 2021, it's outlay 2.23 lakhs crore towards the health and well-being. That's 137% more than that was the earlier year. Similarly, after first and second COVID wave, new private players also looking for investment in healthcare, and we can see that means the people with respect to demands, they have seen that there are no bed availability, there is scarcity of equipments, the medicines, the people are struggling, and they have seen that there's so even when I was doing this, the consulting, I was closely linked with this consultancy in the industry. So routinely we come to know that there are so many new players and the new groups, they want to come up with the hospital. The people like the businessmen, they are just forming the group and they want to open hospitals. Other than that, requirement of skilled resources, the doctors, nurses, and technicians, it's always there. Means last, if you can see from last 20 years, 50 years, it's a universal problems to having doctors and nurses. Even right from 10-bedded hospital to 1,000-bed hospitals, they are facing issue with respect to skilled resources, and that was even exposed during this COVID time. Other than that, to manage the cater large force, large workforce, we need more healthcare leaders. Means in that track, I think already institutes like DY Patil is working, where they have started the BBA program also, and after that means they have doing the MBA. And taking means they have already have a big campus in Nerul, which is supporting whatever they are doing in with respect to healthcare. If you see the job opportunities for the young leaders, there are hospitals from where the journey begins from the executive, which which will reach up to the CEO. There are diagnostic chains. We already discussed about that. There are consultancy firms which are because there is so many investment is coming in healthcare. There are so many groups which are expanding into healthcare. So in that, the people can join from trainee and become up to the partner. There are IT companies, the healthcare. We can see the digital transformation. We have seen the artificial intelligence, the other digital, everything has become digital in healthcare, or the paperless, which we call generally when we used to work into that. There are health insurance companies, right? There are so many groups which are working into that, and then because of this COVID, the percentage of insurance, health insurance also increases drastically. There are NGOs like UNICEF, WHO. There are local NGOs who provide the job opportunities for the young leaders. The public health system, the central government, state government, NHM systems, it's already there, and we can see that post this COVID, they are coming up with so many expansion and new healthcare and hospital projects. Under that, there are so many job opportunities which are coming up in the coming years. There are other startups which recently comes like Pecto, Pristine, Medfin. So these are the other new concepts where they don't have the healthcare facility, but they use the existing healthcare facility, and they come with their team and then operate, and they share the profit and the entire revenue with the partner. And it's a win-win situation for both. There are and this under that model, this Pecto, Pristine, and Medfins are working. If we'll see the pay scale, it's reached from it started from 2.5 lakhs to 2.5 CR. So I have personally I have seen the people in healthcare who has the package of around 2.5 CR. So it depends on the individual and the personality, that where the sky is the limit, and it's bad. What are the efforts you put, and how you work, how dynamic you are, how quickly you learn, and how quickly you upgrade yourself in the years, that will pay you more. There are challenges, if you can see that which our current healthcare system is facing, like lack of infrastructure. India is struggling with defined infrastructure in the form of lack of medical institute and hospitals. Right now, the government has bring up there are so many policies under which there are so many medical colleges are coming. There are, you can already see that earlier there was only one AIIMS. Right now, every state is having one AIIMS. So in that way, other than that, also they in every government has announced that they're planning to come up that every district should have one medical college. So result to that means there are so many new doctors which are coming up to cater the large population, and this will help to give a big support and oxygen to the rural population. Other than that means the tertiary care health, this will cater and help to come up this facilities in like tertiary care hospitals. Also, other than that, we are struggling with to have good critical care facilities. So before COVID, even if we'll talk about this medical college hospitals, even the hospital is 1,000 bed or 500 bed. They have this critical care beds. If you can see the ratio, it's not more than 5%. So there are 15 to 20 beds if the critical care units. So we have faced this during the COVID also, that the unavailability of critical care beds, and then the healthcare system has exposed because of all these things. Availability of beds, especially in public hospital, is always a challenge. If we can always see that there are big queues whenever we visit to the government of the public hospital. The occupancy reached up to the 110%, 115%. I have seen the people are lying on the floors because of the unavailability of the beds. After all these challenges, we have seen the COVID means they're already struggling with the infrastructure, and the facility, and then post COVID, all these things got exposed, and then comes into media. Again, the shortage of trained manpower. This includes doctors, nurses, paramedics. Situation is worse. What we already discussed in rural area, where almost 66% of our Indian population resides. Doctors to patient ratio. It's again what I have mentioned. It's a universal problem. If it's city like Mumbai or Delhi, even they are struggling with to get the qualified doctors, then the situation is not situation is worse in the rural area. If you'll see, only 0.7 doctors per 1,000 people are available, and it should be around 2.5 as per the WHO standards. So this issue can be easily addressed by creating teaching and training institute, which government is already working, and in the coming days we can see that we were more equipped to handle such challenges and the issues. There is unmanageable patient load even prior to COVID-19 pandemic. Healthcare facilities having unmanageable patient load to cater almost 104 billion population of our country. There are health policy and proactive healthcare which comes into the picture. In 2017, government has launched this national health policy. Under that, the PMJY Universal Healthcare Scheme and Ayushman Bharat means they have targeted to cover almost 50 crore population of this country, and then which is rolled out, and then it is right now actively working in all the states, and gradually all the schemes which are running at the state level is going to merge into these schemes. Like if you'll see in Maharashtra, there is Bhabashai Yojana. So all these schemes will get merged into this Ayushman Bharat, and they're planning to merge the ESIs also into this Ayushman Bharat. We can see that in coming years only this one scheme will be there, and the rest all the schemes which are there, which the government is running, there will be only one scheme, and large number of population they have targeted, and they come under the benefits to get under the schemes. Health policy, if you say the health policy should be focused on proactive healthcare, not the reactive healthcare. So right now, what we are doing post-COVID is that we have seen the situation, we have faced the situation, and post that we are just managing whatever we have faced during this crisis, and we have not prepared for that. We have never imagined about such things. There are, if we'll see there are so many books on that this pandemic disease and how to manage it. This was written, but earlier no one has taken this as seriously. Once we have faced it, then now we are just reacting to the situation which are right now we are into. Then National Digital Health Mission is also launched in 2020 to develop the backbone necessary and support to integrated digital healthcare infrastructure for the country. So other than that, the out-of-pocket expenses, if you can see that this also, Dr. Nilesh has also already mentioned about this point, the 65% of the medical expenses are out-of-pocket, means that people are paying directly from their side. There is no insurance coverage. So this will go in the form of cash. The public hospital offers generally the free healthcare service. These facilities are understaffed and poorly equipped. No one wants to go to public hospitals because of all these reasons, and government is working on this by making the investment, and they're improving the quality of healthcare. Accessible and affordable healthcare in public hospital can reduce the rising independence on the private hospitals. The other thing is that, which is a very important thing to take the decision, is the data. The negligible access to the real-time and authentic healthcare data is a big challenge. There are so many hospitals, so many beds, so many patients getting treated every day in under these hospitals. There is no common platform which merge this both public and private hospitals and the patients where this data can collected. if we don't have the correct data, then will be always a problem of assuming and taking decisions with respect to this data can help again, means like suppose the number of cardiology cases we have to see, the number of ortho cases which are coming, we can understand the trends of the disease, and based on that we can take the decisions. So there is no platform which comprises all this data, especially for the non-communicable diseases. Communicable diseases still they are notified, and the government is making records and taking records from the private institutes. So challenges, broad changes. So we have seen the challenges during this COVID times, and because of that, all these changes which we are talking right, the investment has increased, and there are so many things happening right now. So many investors which are coming right now into the picture to do some to cater these challenges. Thank you for giving time and hearing.
Yeah, Sapna.
Can you stop presenting, Amrish? Thank you so much, Dr. Amrish, for your valuable thoughts on this theme. I would now request the students to kindly raise the questions to the participants, if there are any. And we'll have a question answer session.
Amrish, press top share. Press
Yeah.
top share and
It is up. Amrish, you can see up. It will be up. View options, in that you will get stop share.
there you are. That's right.
Yes, shall we have the question answer session, please? Yes, the students, can you please one by one raise the questions, if you have any, to our own panelists or the speakers for the day?
Yeah, Shraddha.
Yeah, Prabhat, start.
Yeah, Shraddha, go ahead.
Unmute yourself and start, Prabhat. Unmute yourself. Yes.
Good evening, everyone. So my question is to Dr. Nilesh Singh. So as you have been a part of most reputed hospitals like Asian Heart and Wockhardt Hospital, and as we all know that almost everybody staying in Mumbai, they know the hospitals. So the reason might be because the hospital might be having a patient retention thing. So my question is that does the patient retention depends more on the clinical staff, or it depends more on the operation people, as they try to make their patient experience flawless, and by reducing times, I mean the waiting times, and also the patient retention depends more on what? So.
Good evening, Prabhat. A very sensitive point you have tried to touch. Is the most sensitive point currently for any hospital. How to retain a patient. Because currently, if you see, patients have become smart. Not smart, they have become more educated, and they have become more of, they are aware. Their awareness has increased. So something called as, patient have started doing a lot of shopping around for the various. Also, what has happened during these years, the paying capacity of people, or paying capacity of people have increased drastically, improved. But still, the patient retention still remains a multifactorial approach. You cannot bifurcate into one way, whether it is a clinical staff or whether it is operational activities. You cannot be bifurcated into one, because both have their own, they have to play their own part. Previously, yes, the clinician or the clinical staff used to, determine, or they used to basically have this patient used to follow them, because India still, was a country which was driven always by clinicians, because clinicians were taken as a god previously. They are still taken as god. So clinicians used to drive the entire healthcare scenario in hospital. But currently, as Ambrish has also told, and if we see, there is a lot of private players coming into the healthcare scenario. Since the private players have started coming into this scenario, there is a lot of being healthy competition between each others. And people have tried to give a lot of good services. And since patients' capacity to pay has increased, also they have now started getting connected digitally more easier, and they have access to the data and to the service standards. They have become more choosy. They have become more service centric, basically. So now the scenario has started to change. Basically, it was totally dependent on the clinician and totally dependent on the clinical staff. But now, yes, it is a mixed of thing. Now patient coming to the hospital, he will always see whether he has got access to a Wi-Fi service or not. Whether he is getting a good hygienic food or not. Whether he has got his admission process is smooth or not. Hassle-free discharge process. Also, the hospitals have tried to enhance the services and the experience of the patients, and people around. So yes, scenarios have started changing, but yes, it is still a multifactorial approach. It is a multidimensional approach still which remains, because yes, clinical outcome is most important. These are all support services which enhance the stay and which makes the stay of the patient much easier. For a very small example, the entire stay is good, but if the discharge process of a patient becomes lengthy or tedious, the patient's experience goes bad, and they, tend to switch loyalty. It is easier, to sell or not to sell, to attract a loyal customer rather than selling and getting a new patient. So for hospitals also have been trying, to retain their patients more and more by various programs, various trainings. They have started doing a lot of loyalty programs, lot of soft skill programs with their staff, various patients, if you go now, a patient who's returning back again to avail other service, there are a lot of loyalty programs which have started, redeem programs, redeem points which have started. So I would say it has become a mix of things, slowly drifting more towards service-related policies. But yes, it is still mixed. Both of them are responsible. Clinical staff is responsible to give clinical care, good clinical outcome. What may come, you give a very good food to the patient, but the outcome is not good, the patient will not be satisfied. So both go hand in hand, and both have to be together. Previously, corporates have now started training their clinicians also to have empathy. Very important word. Previously, people, didn't have any empathy towards the patient. They were taken for granted, but now they have understood. Corporates have started training even the clinicians to have empathy towards the patient, to give more and more concerns towards the patient. They have started engaging a lot of patients with digital programs, a lot of digital activities, a lot of applications, a lot of home care based medicines, a lot of home care stuffs have started. So I would say it is combination of both. Yes, slowly, both are now getting equal opportunities to retain. You may have a very good clinicians, but if your services are not good, a patient will not get retained because he has got options to go to other places.
Dr. Nilesh, can I add just 2 sentences if you don't mind?
Yes, sir. Sure, sir.
Prabhat, it's not only the clinical and the non-clinical, but also 2 very important aspects. And in today's terminology, one is you need a brand image of the hospital. That's very, very critical. Typically, for example, we have in Ghatkopar or Rajawadi Hospital, we have in Sion, a Sion Hospital, okay? When you talk of them, the image that comes up, oh, chodo yaar, forget it, I will not go there. And then what happens, there are messages coming out saying, for example, in Rajawadi Hospital, I just read in a couple of days back that one of the patients died because of a rat bite. Now, can you imagine this? And then what are you talking? You're talking of proper infrastructure. I was admitted to one of the topmost hospitals in Bombay on the western suburbs. The doctor spoke to me nicely. Everything was done properly. The nursing staff was good. I wanted something, they immediately came, give it to me. You know, there was no problems at all. The infrastructure was so beautiful. What do I then do? I recommend people to that hospital again and again, again and again. And when I went to one of these public sector hospitals, you know, for example, in my case, I'm one of the very old people. And when I went to the hospital in those days, and I'm talking of the 70s and the 60s and the 50s, we had only one hospital which was there, or two hospitals. One was KEM Hospital, one was Sion Hospital. And Nair Hospital was known for the teeth, and the crowd was so much unmanageable. And believe me, I was in college, in SIS College, Sion, and what did I do? I took the white apron, and then everybody kept on salaming me, saying that I'm a doctor. I had to do it because otherwise it was impossible. You know, so brand image, infrastructure, the patient admission, patient discharge, the clinical, all this helps a lot. And more importantly, today's doctors have become technology savvy. This doctor who did my prostate, he said, I will not pick up the phone, Dr. Gopal. I will not pick up the phone. But you WhatsApp me and I will answer it to you within the shortest period of time. Fair enough. That sort of an easy availability is important. And I can understand him because he does at least about 100 operations. Maybe 100 is a wrong number, but it's a large number of operations that he does. And this is where the whole setup, the whole organization has to move in one direction with one goal if we really want the hospital and the patients to be retained. Dr. Nilesh, Dr. Amrish, I hope I'm right in what I'm saying.
Sir, you're absolutely correct on the point, sir. That is what I also meant to, brand image is built a day, slowly you have to bring the brand image. And brand image is the impression what people are carrying about your hospital. And it has to be a blend of everything. It cannot be just, a good doctor. No, it has to be a good process, a good SOP oriented hospital also, where he feels that everything is, yes, as per the processes and he's been taken care. Empathy is delivered to the patient and the patient feels that he is considered a part of decision making of his healthcare. Previously, doctor used to just telling ye karna hai aapko, but no, now they want to become empowered to take decisions of their own healthcare, of health. So it has to be a blend of everything.
Yes, right now there are so many systems, the feedback mechanism. We can see the people are looking at right now the Google reviews, the stars which a particular setup or the hospital is having. So it's right now it's a 360-degree thing. Means if you not do good, then you will get the bad reviews on the social platforms. So people are become more smart, and the hospitals are also looking that we will get the good star, the 4-star and 5 stars up to that level. And the marketing guys and the operational team both are reviewed because of that, and their KRS is linked to that in today's to handle all this situation and to give patients a good experience.
Shraddha, you can go ahead with your question.
Thank you, ma'am. A very good evening to all the dignitaries. So my name is Shraddha Zadav and I'm currently pursuing my MBA in Hospital and Healthcare Management from DY Patil School of Management. So my question is to you, Dr. Amrish sir. A very good evening to you. So sir, given the recent advancement in healthcare industry across the globe, how long will it take a country like ours, a developing country like ours, to go completely digital and actively adopt all the new smart technologies like machine learning, robotics, and artificial intelligence?
Digital, if we'll talk about the digitization, it's already there in the system. Each and every hospital is working on HMI system right now. it's just the level of digitization which we have to achieve. Means in that also robotic process automation or robot or AI system, hospitals like Apollo, Max, and the other groups, they are already working on that. Means I also got privileged to work on one of the AI project where Google is involved, and we are working with Bill and Melinda Gates Foundation, where we are developing the algorithms and the codes for X-ray systems to diagnose the TB. So in that, whatever the probabilities were there, the Google is funding for that project, and all this project that requires the big funding and research, continuous research for that. Google is very aggressively working on this, and we can see in next 2 to 3 years that all this will come into the picture, and we will get good benefit out of that. It will reduce the involvement of more human activities, and that will reduce the errors also, whatever they are doing right now. In that also, the quality of care also improved because of all these things, and it's already there. Means in hospitals, hospitals are struggling right now with the outstandings, that if a patient is coming and getting treatment under TP and all these things, they are getting payment in 2 to 3 months. So that every time the patient comes, there are certain amounts which goes up to the year. So all this digitization and all these automatic systems will help to the hospital to improve their tech in getting the payments and improve their revenue cycle. So it's already there. Means maybe in next 2-3 years we will see. Then there are so many big groups which are working right now on this.
Thank you, sir.
Dr. Nilesh, if you want to give your inputs.
Just wanted to add to Amresh this thing. There is one eye care chain of hospitals who is already involved into this AI system, which predicts actually whether the patient, a diabetic patient, depending on their score, whether they will have retinal issues or retinal problems after a couple of years. So the AI has started involving and evolved into such a great extent now that the disease predictions also have started to happen. And as Amrish rightly said, it is just a couple of years, we are just a couple of years away. In few couple of years, we will see all these AI technologies getting involved into predictions of a lot of disease. For example, we take COVID only, the prediction is already there that we will have third wave. How did this prediction come? This prediction came only by using the technologies, using various data analytics methods, various and then only we could predict that we will have probably third wave, whether it will be deadlier, whether it will be a pediatric population will be involved in that or not. So we are already there, we are already using, we are already done. Yes, the extensive use, slowly time will come where we will have to move to digitization and digital era if we have to cope up with the other countries and developed countries.
In fact, Jadhav, Shraddha, I can tell you only one thing, because Mr. Pichai, the CEO of Google, every quarter, once in a quarter, comes up and talks on introduction of AI into various aspects of medical diagnosis, including prediction for cancer and all these things. And this therefore throws a lot of opportunities to you students. Opportunities exist in a very, very big way, because AI cannot remain only in the R&D laboratories of Google. It has to come down, as Amrish and Nilesh are saying, to the hospitals. And then if you have a little bit of knowledge of IT coupled with the knowledge, basic knowledge of medical science, I think you have the world opening up before you. And not only that, the other big opportunity that I see is, because every 5 years, as I said, there is some disease coming in, whether you like it or not, it is there. And therefore, the pharma industry will keep on booming. There is no doubt about it. And if we see today also, the stock market prices are shooting up in the case of pharma products. Whether you call it 2DG, whether you call it Zycov, or you call it the cocktail mixtures, everything is there. Now, if that has to be sent to the public, then you need somebody who can talk to the doctors to explain to them. You need somebody who can work on the presentations that needs to be made to the doctors, explaining the details. You need somebody who can write, if you open up a pharma product, in font 4 or font 5, you find everything written out there, which is totally not readable. Unless you expand it to almost 400 times, then only you can strain yourself and read it. Otherwise, it's not readable. So you need somebody to do all these things. And therefore, opportunities for all of you guys are heavy. It's just plenty. But as Amrish, as Nilesh said, you need to have that fire in the belly. It doesn't come like that. You need to work hard. You need to have a passion. You look at these guys, these are all the stalwarts of the health department. And they are today earning. Now, I will not, I'm just venturing a figure. I'm not going to ask them anything. Yeah. But they are today earning in crores. Yeah. And how do they get it? They get it only by working hard. And that's what the key is. Yeah. Okay, I think Sheetal, you can take over now with the next question.
Neha, you can go ahead with your question.
Hello everyone and good evening to all the dignitaries present here. My name is Neha Pawar and I'm from third year BBA Hospital Administration, D.Y. Patil University School of Management. My question is to Dr. Nilesh sir. Talking about the opportunities and challenges, I would like to ask what are the opportunities and challenges for providing contactless healthcare services in the post-COVID time?
Good evening, Neha, and very good question. Basically, a futuristic question. What you asked, As I said, the future is digitalization, and the future is you pick an idea basically, and you can develop that idea. I'll just give you an example, like what Amrish said, into his that the aging of revenues, which was happening for years, and the hospitals were not aware about their revenues getting aged for years, and they were not able to recover it from the corporates. One of my known, he has come up with a very nice application, a small application, which gives a dashboard to the senior management, which reflects the aging of each and every file and each and every patient got discharged from the hospital. So the senior management has a control of the entire revenue cash flow happening in the hospital. They know which file has aged for around a year, which file has now got more than 90 days of their revenue. So there is opportunities in front of, for example, you take healthcare, home healthcare. There are big companies now getting into home healthcare because people have realized now in near future, it will not be possible for the patients to come here, or the cost will not be probably, they will not be able to afford the cost for care. So they have got into home healthcare, like hospitals like Apollo has started their own separate of home healthcare. Pristine, Practo, you name the company and they're going into home healthcare. So I think in near future, you should have an idea and you should have in your thing that you can develop the idea. Opportunities are going to be there. It's the opportunity, as Amrish said, healthcare is a non-recession, is a recession-proof industry. Gopal sir also insists, on the pharma sector. So you should have an idea post non-COVID. We don't know what is going to come. What is COVID going to give us as a complication? To just give an example, we don't know what complications we are going to have. People post-COVID, post-COVID complications, whether people are going to have heart problems, whether people are going to have fibrotic problems, what problems they're going to have. So post-COVID is an era, you have your own vision, you have to have your own idea, you can develop it, and I think there is no boundary for your thing to grow.
I request Dr. Ambarish to add on some points.
So right now means there are two sectors which or the two new positions which aggressively working. One is data analytics, which is very important position which is hospital is having right now, because there is so many data which comes every day into the hospital, and to take further decision that data analytics, that people who means the big groups are hiring from the IIMs, but still means the people from who are doing the MBS, they can, if they have good working knowledge of Excel, so they can do the data analysis, and then having the understanding of basic understanding of healthcare, they can help to hospitals to take decision on that. If we talk about the COVID situation right now, means it's whatever happened is no means all the prediction has failed in that, and we are just responding to whatever happens in front of us. We know that after first wave that there are chances to come, the second wave will come, but we have underestimated that thing, and then post that we have faced the second wave, and I hope that we have learned from both these waves, and after all this big disasters, that we may have prepared for the third wave, and things will improve in the coming times.
Thank you so much, Dr. Amrish. Thank you so much, Dr. Nilesh. We have few questions on YouTube live chat. So, first question is to Dr. Nilesh. Could you please tell us about your real-time toughest situation during COVID-19 management?
There have been so many incidences, we can narrate, but I would like to, narrate this incident which we faced during the second pandemic. Second pandemic was much more difficult as compared to the first pandemic, because in second pandemic we saw a lot of young crowd getting infected into this. So on one of a typical working day, I had happened to come to the hospital doing my routine rounds, going around. I met a 6-year-old child down on my basement in the reception. And that child was crying and wanted to meet his father. And his father was on ventilator since past 25 days. It made me also emotional, made me also to cry. We all have seen in this pandemic, so many difficult situations. Our near and dear have somehow got infected. They have been, suffering from so many things. Our kids have not been able to go down, to play around for past 1.5 years. Believe me, this is a very tough time. And that was one of these scenarios where I myself being so, I was into emotional, because I could not help that kid. I could not take that kid to meet his father. Eventually, the father expired. He was just 39 years old. And I can still remember the face of that child in front of my eyes. Sometimes I still remember those small hands of that kid, which was trying to hold my hand and, trying to ask that he wants to meet his father. These such scenarios have been coming day in, day out with us. We have been handling, not only with us, it has been handling with the doctors who are going every day. It has been an emotional turmoil for all the healthcare workers, doctors, because they are the family of the COVID patients whom they are treating. Unfortunately, this disease does not allow the relatives to be along with the patients. The doctors have been their family. They celebrate their birthdays, they celebrate their anniversaries, they celebrate their, they listen to their problems, they listen to their anything and everything what they want to share, because the family members are not available. They are there to motivate the patients. They motivate the patients to recover. They motivate the patients to come out of the ICU psychosis. So this pandemic has been very tough, difficult for the entire healthcare fraternity. So this was one of the incidents which I will never forget in my entire journey career.
Yeah, Sheetal, just one minute, okay?
Yes, sir.
I want to add on to what Dr. Nilesh said, and this I want to do it for the benefit of all our students and all the people who are viewing. Yeah. Dr. Nilesh just talked about a certain incident. But what that incident clearly showed was that every healthcare personnel, whether he is in the clinical side or non-clinical side, must have an emotional stability. You cannot become emotional on seeing things. You got to be dispassionate yet passionate. That is some art which you got to develop. And if you look at it, the patient, the child was catching hold of his hand and talking to him and wanting to see it. And he was holding it. And he was just not holding the hand of the child, but he's actually showing empathy to that child and telling the child, I will take you, don't worry. This empathiness is required. And if you observe one thing, all of you all, both these two gentlemen, yeah, only now I see their smiles vanishing, but others, they've been always smiling. And that is what is required of every health personnel, smiling, pleasing personality. And why do doctors get hit? If you look at it, why do doctors get hit? And during the pandemic, we've heard so many things. Why? I probably feel that A, lack of empathy, and B, lack of or inability to give a very diplomatic, strong diplomatic answer rather than a curt answer. Nahi hoga. Ye nahi hai hamare paas. You got to generate a ray of hope to everybody, because hope is the only thing which really pulls you forward. And that's something which is very important. And have you all noticed something during the pandemic? There were a lot of videos which are coming in where the doctors, nurses, the other people, they're singing and dancing in the ICUs and all that. Why are they doing all this? They're trying to bring about a culture of saying that, okay, we are all one. Let's face the problem together. Let's work together. They're trying to drown. They're trying to drown and say, you have your problems, I have my problem, but let's all work together. Let's all enjoy life and let's move forward. These are some things which are very, very important. And these are not just for the healthcare, but these are the things which are required in order to lead a very healthy and, most important, not wealthy, but most important, a very happy life. Please correct me if I'm wrong, if I've said something wrong, Nilesh and Amrish, but this is my personal view on the various issues and taking off from what question the child asked.
Yeah, one more question is there.
Sir, things have been difficult for the entire healthcare workers. Let me tell you, sir, I would add one more point. Things have not been easy for the healthcare workers for past 1.5 years. It has been very difficult. Believe me, it is not easy to stay in those PPE, wearing those PPEs for 6 to 8 hours. Normal people like you and me cannot wear it continuously for 1 hour. They have been wearing it day in, day out. They have been wearing it for 12 hours, 24 hours work. I have seen doctors working 24-hour shifts also because they didn't have the relievers. And they cannot leave people in the ICU just like that, and they cannot run away. The pandemic, what has thrown it to us is something is extraordinary which has thrown us. We could not have even imagined to handle such type of pandemic. Not going for washroom for 6 hours, 8 hours, and then I have seen doctors who themselves have got infected. Not by just by COVID, they've also got urinary infection. They don't get to eat for 8 hours. Believe me, wearing that N95 mask for 1 hour is not possible. You know, we cannot wear that one hour N95 mask, but they have been wearing it since morning till night. Yes, there has been incidences where people have been rude and difficult, but what we have seen with our experience in these days, since their relatives have not been there, doctors have tried to be their family members. I have seen residents coming out and crying, you know. They have seen people dying in front of them and they could not help. They could not allow their relatives to come and meet them because of the scare of getting infected. They had to become their relative and hold their hands in the last minutes. And you imagine if someone is dying in front of you holding your hands, how difficult it is to do that. But this has been happening since 1.5 years, 2 years. Things have been difficult for healthcare workers, but yes, we all have stood together fighting this pandemic. We all are hoping and praying this pandemic should go down with a lot of vaccinations happening around, and hope things should be better.
Excellent, excellent. And my heartfelt kudos to all of you guys for doing such an excellent job. Yeah, thank you all of you all. Yeah, Sheetal.
Yeah.
The next question.
Next question is from a student that for recent graduates from non-clinical background, what are the opportunities in healthcare during the pandemic? How can we look forward to a career in healthcare? So,
sorry, Dr. Sheetal, I could not hear you. Probably was it that for me or for Dr. Ambrish?
yeah, both of you can add on something because
Okay.
it is a career.
But I didn't hear the question because there was some connectivity issue.
Okay,
Can you repeat, please?
I'll repeat it. For recent graduates from non-clinical background, what are the opportunities in healthcare during the pandemic? How can we look forward to a career in healthcare?
I think, this we discussed previously, but, I again would say that, the healthcare is a recession-free. But yes, you should have your own idea, healthcare is growing by folds, multi-folds. Even the government has realized that they need to invest into healthcare, and healthcare needs to be developed to a various different level. The tertiary care setup should be available in the rural India. So with seeing such an expansion of healthcare by the government, there are a huge number of opportunities which are going to come in near future. This comes from the public sector, private sector itself. Dr. Ambrish also, he has pressed upon various data analytics and other aspects. AI itself is one of the stream which can be developed by itself. Current pandemic, there is a huge scope for entrepreneurs to, come up. You have seen small entrepreneurs coming up. I will again share one more small example of one of my friend who has come up with a small idea which we would have not even thought about. We have this vaccination drive happening everywhere. But how do we reach to the common public, to the rural area, to the deepest of the slums in the Mumbai? So he came up with an idea to become an aggregator who would provide manpower to give these jabs into various housing societies and various areas. He collaborated with various bigger hospitals who had crunch of manpower. So he took up that idea, and with that idea, he is currently collaborated with Wockhardt, with Apollo, and with Nanavati group of hospitals. And per day, almost he is giving a jab of 15 to 20,000 jabs per day. So what I mean to say is it's your one small idea. You should have that idea to develop it and to build it. And with this COVID pandemic, it has thrown everything. How you can cash on that idea is on you. It is a big opportunity which is coming up. Home healthcare is a bigger space which is developing up slowly, and it is a very big opportunity. It is multi-billion project which can be developed, because you do not have many players into home healthcare. No players who are already established players. So all players are new. Even if you take Apollo, it is new into that segment. It is not, Apollo is an established segment in healthcare, hospitals, but not into home healthcare. So it's a totally area which has not been explored till now. It's a big area and a big place which can be explored. So there are various opportunities available, starting from, as Amrish said, there's a lot of investment flowing in the hospital sector, a lot of new hospitals coming up, a lot of new things coming up in the hospital sectors. So there is huge opportunity coming up, in public, private, as well as an entrepreneur side of this.
So I will just add into that. Means whoever is doing BBA or MBA, and when they are doing their trainings and internship, during that time only they need to understand that which department is suitable for them, and where their interest is. Means they get exposure of all the departments in the hospital while they are doing this training and internship. At that time only they have to realize that in this area I can do better, or this is my interest area. The second thing is that they don't need to restrict themselves by using word non-clinical. I can give you so many examples where the leading CEOs or the directors are from the non-healthcare background. So it depends on their interest. So whenever they get opportunity, also when the initial phase, when they get into the hospital, at that time they are not expert. So that means they can get quality or any ward responsibility or MRD responsibility. When anyone join as a fresher to a hospital, they may get exposure of all the departments. During that time only they have to decide that this is my area and this is where I have to see myself growing. And eventually they need to understand, if they want to become CEO or director, they need to understand all the departments. Then only they can survive after 5 or 10 years. Otherwise, it means if they just pick up any 1 or 2 departments, this is not going to work for them.
Sheetal, Sheetal, just correct me if I am wrong.
Yes, sir.
Okay. We have a 2-month program, summer training program at the end of the first year.
Yes, sir.
Right?
Yes, sir.
And then we have in the third year, first semester, first semester, we have live projects for them where the student has to go to the hospital or healthcare department and work for about 2 days in a week or 3 days in a week, something like this.
Yes.
Plus we have industrial visits. I call it industrial visits, but you have also 1 day visit, 2 day visit to the various hospitals.
Yes, sir.
And then you have a lot of these doctors coming down and explaining to them the various processes which are there.
Yes,
Am I right?
Yes, sir. Actually, since their first semester, like when student is entering into MBA program, from the first semester onwards, student is doing live project, where the live project is a compulsory subject of 100 marks, where student is going for 3 to 4 days in a week in the hospital, different hospital like Wockhardt, Nanavati, then MP City Hospital, Cloud9 Hospital, like Fortis, big brands we are sending our students for their live projects. And after that, once they are completing their exams of semester 2, they are going for summer internship for 2.5 months. Again, once they are coming back from their summer internship, for third semester again they'll be going into hospitals for their project study. And for BBA hospital administration students also, From their second semester onwards, students are going for 1 or 2 days in a hospital. For first and second year, we are sending them in our own DYP hospital, DY Patil Hospital, Nerul, and in third year, they are going in a other hospitals. So this is the.
So therefore, this gives the student actually a very good feeling of what Nilesh and Amrish are saying about which area they want to go and what they want to do and all that. And if I'm not mistaken, Dr. Sirish Patil, as well as he was telling me that he has used our students to help him in getting the
NABH accreditation, sir. Yes.
NABH accreditation process,
Yes.
right?
Yes, sir.
So the student automatically understands the entire process and the methodology for getting this NABH accreditation.
Yes. Actually,
And then he can give
both.
consultancy services to all the other hospitals in
Yes, sir.
future.
Yes, sir.
Yeah.
Actually, our
And now taking a cue from what Nilesh has said, yeah, the aggregators. Take my own case. I'm now around 67 years old and I'm scared to go to any of the hospitals during the COVID period. I was really very sad, but scared. And I needed to do a lot of my tests, which I do every quarter, like not only sugar, which I can do at home through the glucometer, but also I would do the T4, T5, T6 pathological test. Then I would do the B12, D3, then the hemoglobin test, then all the other tests which are there. I've got a series of about 10, 12 tests which I do. And I was looking out for somebody who would come home and take the blood sample from me. And I found there were people in Thyrocare who were employed by Thyrocare. They would come, they would have their own setup, about 3 or 4 people who would come, take the blood from me and go away. And then this guy would then ensure that it goes to the Thyrocare center where it is done and all of that. I mean, basically the aggregation job. So there's a lot of opportunities in there also. There's a lot of opportunities in medical insurance. That's something which is growing. Amrish talked about 44% of the population being insured, right? And many of these insurance companies like the ICICI and Star Health and all these people, they are looking out for people. And they pay well also. In our own college, I mean, Sheetal, please correct me if I'm wrong, the minimum salary has been about 4 lakhs of rupees.
Yes, sir.
And the average is about 5. And if I'm not mistaken, Kiran, and you were telling me once, the maximum salary has even gone to 8 lakhs of rupees.
Yes, sir.
Right?
Yes, sir.
So you can see this, the opportunities are great, whether you're a clinical side or a non-clinical side, and whether it's COVID or non-COVID. And if it's post-COVID, because of the lessons learned during the COVID period, the opportunities are tremendous, so nothing to worry about it. Yeah, thank you. Yeah, Sheetal, take over.
Yeah, actually, are both the courses BBA Hospital Administration and MBA Health and Hospital and Healthcare Management. Both the courses are blend of practical as well as theoretical knowledge, because students are sitting in the lectures for 3 days in a week, and 3 to 4 days in a week they are going for a hospital project study. So because of this blend, students are making their placements available for themselves by themselves only. Like these students who are working for live projects, they are getting absorbed in those organizations for their final placements. That is the beauty of our courses, actually. So over to Sapna ma'am, over to you ma'am.
Thank you so much for such a valuable thought process from our speakers and upon opportunities and challenges which are there and transformation in the health sector. Before I place my formal thanks, I would like to again mention that we at DY Patil Deemed to be University School of Management have a 3-year BBA course. The admission for which is open, we have a 2-year MBA course, the admission for which is open. So whoever wishes to take admission can get in touch with us. We also have an upcoming webinar which is scheduled on the coming Saturday, which is on emerging role of management in the sports arena. So wish to see you all on that webinar, which is scheduled on Saturday. I would now like to place my thanks to our university officials, the chairman, the vice chancellor, the chancellor, and the registrar. I would also like to place my thanks to Professor Dr. R. Gopal, Director and HOD of DY Patil University School of Management, Dr. Vani Kamath, Dean of DYPUSM, for giving the opportunity for holding such a webinar, Dr. Sheetal Naikwade for conducting such a webinar, our eminent associates in which we are being associated with Indian Merchant Chambers, MSME, Chamber of Commerce and Industry of India, New Delhi, World Trade Center, Navi Mumbai, Maharashtra Chamber of Commerce, Industry and Agriculture, MCCIA, Global Exports India, Global TV, for giving the opportunity for conducting such a webinar. I would also like to place my thanks to our today's speakers, Dr. Nilesh Singh, Dr. Amrish Sharma, for enlightening us with such a wonderful topic on transformation of healthcare opportunities and challenges. I would also like to place my thanks to our students who have put up the questions to the panelists and the speakers. And also I would like to place my thanks to the viewers who are watching our webinar, the faculties, and also whoever is watching from wherever this webinar. Thank you so much for having such a wonderful session and making this session successful. Thank you so much.
And ultimately, you forgot one line, Sapna.
Yes, sir.
Don't forget to like, share, and subscribe the channel.
We have our own channel, which is DYPUSM webinars. So whoever wishes to view our own webinars which have been conducted previous year also and this year also, and the upcoming webinars which are there. So I would request you to kindly like, share, and subscribe our channel. Our channel is free of cost. So please kindly like our channel and share it and subscribe it also. Thank you so much.
Done, sir. Subscribed and liked both.
Yeah.
It's a new slogan.
You can click on the bell button also. Thank you.
Thank you.
Thank you so much, sir.